Hi, I'm Morgan Tracy, Wesley's maternity nurse navigator.
And I'm Jolinda Kelly, the perinatal nurse navigator here at Wesley Medical Center. In a few moments, I will tell you about the specialized unit we have for our high-risk moms.
We are here today to take you on a virtual tour of Wesley labor, delivery, and postpartum, as well as our birth care suites. Here is the entrance to our birth care suites. This circle drive can accommodate 2 vehicles, so if you're in labor, you can park your car here, then your support person can move it once you are safely in your room. If you're wondering, there is criteria that must be met for you to be able to deliver at birth care suites. These criteria are for you and your baby's safety. Here are some of the criteria. You must be 37 weeks gestation or greater, only 1 baby inside, low or no risk factors, no previous C-sections, and a BMI less than 40 at your first prenatal visit. Please talk with your physician to see what's best for you and your baby. When you arrive here at Birth Care Suites, someone at the front desk will screen you and your support person. When you are 37 weeks or after you have your Group B strep results, you may schedule a pre-admission testing appointment with one of our nurses. This allows you to complete your health history and admission paperwork prior to arriving in labor. This makes the admission process much smoother and quicker. Their office is located inside the Birth Care Suites, making for easy access. If you've been at Wesley at all in the last 6 months, you know that our main entrance has undergone some changes. We did have you walking outside on a walkway. Our main entrance from the parking garage is open again now with a few updates that we hope you enjoy. As you come in, you'll see that we've updated the tile. You'll follow the yellow signs to the main hospital and registration. You'll make a left here and keep following the hallway.
Main entrance, this is Vicki.
Here's a little glimpse into what we've been working on behind the scenes here. This is some of our updates as to the women's hospital secure entrance. Behind these walls still, we are working quite hard on the elevator bank and a few offices and waiting rooms back there. You'll continue to follow signs. You'll go past registration, past this desk, to the purple sign that tells you which elevator to take up to labor and delivery. Here's the sign I was talking about. You'll follow it to this set of elevators right here, where you'll just push the button to go up to the 2nd floor. As you exit this elevator, there will be more signs for you to follow to go to the check-in desk. You're going to take a left, and then another left, and this will take you to the entrance. You're going to check in here at the front desk of labor and delivery. We will ask questions. Mamas, you will fill out the same piece of paper whether you're here 1 or 10 times. That's for identification purposes. And all visitors, so your support person as well, will fill out the sign in and sign out sheet when they are here on the floor with you. This is our OBED. This is where you will start if you come in unscheduled. These rooms are smaller. They're designed for us to be able to assess. You're in here ideally just an hour or 2 while we decide if we need to admit you or if we can stabilize you in this room and send you home. This is our main nurse's station here. Here is where your nurse will sit. If she's not in your room, we do have central monitoring, so she's still able to watch baby, even if she's giving you privacy or if you want to take a nap. We do have 20 labor and delivery suites. Each one has their own bathtub and shower. They are all temperature controlled, so you can make it as warm or as cold as you like. We have multiple blanket warmers on the unit as well for after delivery, but those are also able to be utilized during labor for your partner or for yourself. This is one of our blanket warmers. You will see many on the unit. They look scary, but they really are warm and fuzzy. This is one of our labor and delivery suites. Each room has quite a bit of space. We do have a bed for your support person. The back is a mattress. We do have linens and pillows available as needed if you're here overnight or if you would like to take a nap. Each room does have the jetted bathtub as well as the shower head and the removable shower head so that you can get as comfortable as possible during your labor process. Here at Wesley, we have multiple labor support items you can utilize during your labor and delivery. We have 2 types of birthing or yoga balls, different sizes of peanut balls, as well as a squat bar which can be utilized during the 2nd stage or while pushing. Each of these items can help with the labor process and keep things moving towards delivery. After delivery in this room, your baby will be placed directly skin to skin with you. All initial assessments and vital signs will be done with baby on your chest. If you're planning to breastfeed, your nurse will help you recognize cues from your baby that they are ready to eat and help assist with that first latch if necessary. After the hour of skin to skin, or when that first breastfeeding session is complete, we will then take your baby to the warmer and finish our assessments, as well as obtaining your baby's weight, length, and other measurements. You and your baby will remain in this room together for 2 to 4 hours after delivery. Your baby will stay with you for the entire hospitalization. NICU is located on the same floor as labor and delivery here in the hospital. That way, if there are any complications that should pop up during labor or delivery, they can be at the room within minutes. Also, if you are before 37 weeks, we want you delivering in the hospital as opposed to the birth care center, because we have NICU right here should baby need any help transitioning. We do have 3 operating rooms here at Wesley Medical Center in the hospital. One is designed specifically for multiples. If you were to have an unplanned C-section, this is where you would go. You would stay in labor and delivery. We have our own ORs. You would not go to the main OR and then back here. You would stay in your room, go to the OR, and then come back to your room. You're gonna have your same nurse that whole time. If it's an unplanned C-section, we usually will take mama back first. We'll have dad put on a jumpsuit, a hat, a mask, and shoe covers as well. And then we will get him back to join mama just as soon as possible.
If there should happen to be any complications that arise during your pregnancy, we're here to help. Our highly skilled, specialty trained physicians, nurses, and other care team members provide exceptional, individualized, patient and family-centered care. We have designed the 4th floor of our women's hospital specifically for our high-risk moms who have to remain hospitalized until their delivery. Our nurses here are highly trained to spot any changes that might arise and are able to quickly transfer you to labor and delivery should that be necessary.
After your recovery is over on the 2nd floor, we will head up to the postpartum unit on the 5th floor in the women's building. This is our postpartum floor. This is our main nurses station here, and then we have 3 separate hallways with patient rooms. This is our postpartum room. These rooms are a little bit smaller than our rooms down in labor and delivery, but they're designed for resting, recovering, and bonding with baby. We have mom's bed, and then her support person will sleep here on the couch. We do have linen available for that and pillows as well. Just ask your nurse. Up here we do have the Mama TV. This has TV, movies, and then all the patient education videos that you will be asked to watch before you leave. It also has your phone, so you can call in and out of the hospital. Your nurse will also put her number on the whiteboard, so you can call her or use the call light. We also have pumps in every room for the postpartum, so you don't need to stress about bringing your own pump. And then we'll have everything you need for baby as well. Here's our bassinet. We have diapers, wipes, baby wash, all of that stuff. And then up here, the only difference with the bathroom is that it changes from a tub into a walk-in shower. We do have a bench, so you can still sit and relax. The shower head is adjustable and removable, so you can just sit and relax and not have that water in your face if you don't want it. We'll have everything for mama afterwards as well. Up here is where lactation services will see you, as well as our baby bloom photography service. They'll come see you within 12 to 24 hours after delivery and set up an appointment time.
Thank you for taking the time to come on this virtual tour with us.
We hope this eases some of your anxieties and helps you understand our current process. If you have any other questions, please don't hesitate to contact either of us via phone, text, or email.